Thank you for inviting me to this wonderful conference, to Dr. Sanjay as well as to the whole association. Actually, I'm quite privileged to be called upon to talk about this. I think the topic that I was given was post-transitional sort of care, looking at people's lives, once they have transitioned. I can sort of obviously add a little. I don't. Dr. Vaidya is a very esteemed colleague, but I'm not sure what has happened to his video and audio feed. But I can add a bit about sort of my experiences as well. Um, in certain terms, obviously they're different because of cultural and social differences that we've already talked about. But in other ways, they're similar as well. This process that you're talking about in this conference, I think, has been gone through, in the Western systems in the past decades, and gender sort of care has become much centralized and much better in the last few years. I work in a gender specialist team that was being talked about in the previous presentation as well. And that part of that team sort of includes doctors, nurses, psychologists, and so we work as a team to try and help a person's journey. Now, transition itself is, I think, it's not just one point in time that people go through when they are progressing through their journey. It's a sort of like a process. It's also a journey that somebody goes through. Now, what has changed in the systems that I work in is that previously there were people who were coming out really towards the end of their sort of social life, if you want to call it, that they were in their 50s, 60s, and had gone through sort of their family lives, and in the end, once sort of everything was sort of settled, they would sort of feel much more comfortable and easier or confident to come out. Now, what we've sort of have from sort of last few years, when it has become much more easier to access care, is that we have younger patients. Some of them are actually sort of been involved in child services, so we only see sort of adult services, but we see people who have sort of after the age of sort of 17 and a half. And 18 is the age of majority in UK. And the process of transition actually starts from pre-transition. I would say that a person's transition really begins from the time when they sort of start talking about how they can start achieving the change in their life that they want to have. It may be that they already have mental health problems, and we've discussed that majority of people actually do have some sort of mental health problems by the time they come to services. And one thing may be to try and stabilize their mental health first of all, so that they're able to sort of undergo the process of transition. The transition process itself starts from obviously starting to discuss what available treatments are there for people to have medical treatment, but also, as we were discussing earlier, the guidelines quite helpfully talk about is the social aspect of the transition, how a person fits into the society, and especially when they're undergoing a transition from sort of in their gender, how they're going to fit into society. So that's the aspect of sort of the transition care that starts from before the person starts transitioning, and then we help the person through the process of transitioning, which can take up to sort of from sort of say at least a year or 2 years to sometimes many years, depending upon how the person is able to adjust to their new sort of role, how their sort of other aspects of their mental health or their physical health are impacted by their transition. And towards the sort of end of the transition is when people sort of feel that they've had the surgery. So the surgery is usually considered as the last final goal, where people can then sort of have a feeling that they have finally achieved a transition completely. I don't have any presentation slides. This is a Sunday here, and I've sort of thought I won't bore you with a lot of sort of slides about this. I think we've already discussed a number of aspects of the transitional process that a person needs to sort of go through. The post-transitional aspects specific to medical treatment are that once a person is established on hormones, then it's sort of the ongoing care that they need, and especially after surgery, because if the surgery leads to what is called gonadectomy, basically that their natal hormone cannot be produced in their body, then they will need to continue to take one or the other hormone throughout their lives. And the aspect of that part of care can be taken can be taken forward through primary care, and primary care physicians can look after an established stable hormone treatment in both trans men and trans women, or binary, or whatever the person wants to identify as. The aspect of non-binary again is that sometimes people sort of have the misconception that they do not need any hormone. That unfortunately is not possible. The human body needs one hormone or the other, and that needs to be continued throughout people's lives. The aspect about surgery is that once a person has had the surgery, post-surgical care usually comes through post-surgical care usually comes through in immediate sort of if there's any complications in the surgery, or later on if there are any problems. So the immediate sort of care is usually provided by the surgeons who have done the surgery, who would be able to review the patient in case there is any reassessment or review of the surgery that is required. And the later on care goes through the normal process of going back to primary care, and then being referred to local secondary care, so sort of local obs and gynae departments if that is needed, or local sexual health clinics if that is needed. The gender clinic will offer people re-referrals back into our service if that is needed. But usually our experience is that once people have had surgery, by that time the requirements of the surgery are that they should already have been established in their sort of roles in society. So surgery is considered as the last step for them, and after that usually what happens is about an hour, a year afterwards, people usually seek a discharge from our gender clinic to say that if it's only sort of primary care that I require, I don't need to sort of be seen by a national service like us. I'll just go back to my family physician. So that's the concept of a post-transitional sort of care. Now, psychologically, the person who's going through the process of transition, we only sort of refer people for surgery once they have started living as themselves, as they want to live as themselves. And therefore, hopefully by that time, we know the person quite well. We are able to help them with any ongoing psychological or mental health issues. And if there's any other sort of aspect of care that is needed, we can provide that. So by that time, people would already have sort of gone through sort of, their gamete storage. If they want to sort of preserve their fertility, they would have had sort of, certain level of treatments like hair removal or voice, modulation help. And so hopefully by the time they come up for surgery, they are already living in the role that they, want to live in. And therefore surgery doesn't, have a direct impact on transitional sort of, care in terms of sort of the psychological aspect of it. Of course, it is a major thing for people to have, and it is considered as the last thing that they would want to have before they feel themselves complete. The social aspect again sort of is tied to the psychological aspect, as I said, that they're already expected to be living in the roles that they want to. And one of the main sort of things that we sort of find that people taking longer time to transition is usually around the fact that psychological or social issues might already be there, which they find difficult to to adjust to, or if there's any other problems. Um, and that is one of the main reasons that surgery might be delayed, is that surgeons need to feel comfortable about sort of the person's living in the role aspect, and that is one of the sort of main aspects of care that we provide from the gender clinic. I can see a question from somebody. What's the average length of time that someone would stay in care? So usually, I think on average, I think around 18 months to 2 years, I would say, probably, if they're able to progress through hormone stabilization, relatively without any problems, as well as go forward for surgery. So one of the main aspects of requirements of surgery is for them to be living in role for at least 2 years.